Very high yielding, ma. Trust me, general pharmacology, we have some 4 or 5 images, very high yielding images with respect to image point of view, and as well as what you call theoretical point of view. They will give statement kind of questions. So this is what the image which we have. This is what the image which we have. See here, see here. Here on x-axis we have drug concentration. Here on y-axis we have the response. So here on it, I can say it is like x-axis and y-axis. So here we are dealing with drug concentration and as well as response. So here, based on drug concentration and response, he has given 4 graphs. He has given 4 graphs, first, 2, 3, and 4. And he may ask you identify the graph. What might be the second, what might be the third, fourth, like that. So now the first graph will be, so based on this, so before going to the name of the first graph, let me put a small introduction in front of you. So we have a drug. It always try to combine with the receptor and forming drug receptor complex, and this drug receptor complex always forms a effect or action, whatever it may be. It forms an effect or action. Now, the ability of the drug to form the drug receptor complex is called affinity. It is termed as affinity, and the ability of the drug receptor complex to create the effect is called efficacy. Efficacy, or I can tell you intrinsic activity. Anything is fine. So we have 2 definitions, affinity and intrinsic activity. And based on this efficacy, we have different categories of the drugs. It might be agonist, partial agonist, inverse agonist, anything. Here in the table, we have given a clear-cut information: agonist, partial agonist, antagonist, and inverse agonist. For all, affinity will be high. Remember, affinity will be high for all. Affinity will be high. So no confusion here. Affinity will be high for all. Now, based on intrinsic activity or efficacy, we classified them into 4 categories. So here, agonist means we have highest efficacy. That is, this is for the agonist. So this is for the agonist. We have highest efficacy. And it is a bit high, but it's not that compared to agonist. That is what we call partial agonist. And affinity is high, but there is no intrinsic activity, is just a 0. That is what we call antagonist. Remember, it is 0. That is literally 0. And inverse agonist. Inverse means opposite thing. So this is what inverse agonist. So that is what an inverse agonist. We have negative thing. Here we can see from 0 to negative. Remember, this is where examiner tries to confuse you. Efficacy is 0 for antagonist and it is negative for inverse agonist. So this is what the thing, this is what the thing here. Now we have all the examples, agonist as well as partial antagonist examples. There's numerous examples which we need not to discuss now. Everyone knows all those examples. Here, the point here is inverse agonist beta carbolin and nalmefene. These 2 are the characteristic examples which examiner wants to test you there. And here I want to talk a little bit about partial agonist, little bit about partial agonist. So remember partial agonist examples. Here we have given few examples and few more examples of partial agonist are aripiprazole. We have, that is antipsychotic, 2nd generation. Buspirone, and then buprenorphine, and we have clomiphene citrate, and we have selective estrogen receptor modulators. These are all our partial agonists. They may ask you, he will not ask you the partial agonist antagonist, he will ask you the examples. Examiner always try to ask you the examples. So these are all the main partial agonist examples. The agonist and antagonist obviously will answer, that's secondary. Partial agonist, he will try to confuse you there. This is what the thing which I want to tell. And one more, a very important concept I want to give here, very important concept, which may expect in the next coming exam. Here you can see, if you combine partial agonist and as well as agonist, so what is the net effect? If you combine partial agonist and agonist, what is the net effect? There will be decrease in net effect. Remember, Very important MCQ. If I combine partial agonist and inverse agonist, there will be decrease in net effect. Why? This partial agonist, it tries to occupy most of the receptors, but efficacy is low. And if you combine partial agonist and agonist, this partial agonist act as competitive antagonist. It acts as competitive antagonist in the presence of agonist. Remember that. Now we will see the example. You will understand. We will see the example. You will understand. In morphine dependent patient, if you give buprenorphine, what will happen? Withdrawal symptoms, precipitation. See the thing here, explanation. So morphine dependent patients, buprenorphine is a partial agonist, this is agonist, this is a partial agonist. If you combine those two, there will be a decrease in net effect. And I told you it may act as a competitive antagonist. So there will be precipitation of withdrawal symptoms. Remember, a very important MCQ here. If you combine partial agonist and agonist, there will be decrease in net effect and partial agonist act as a competitive antagonist. These are the important points which I want to focus more here. So now, so this is what the thing which we have. And then see the question. Which of the following is true about 4 in the given image? So first of all, you need to identify the 4 there. You need to identify the 4. What is 4? Inverse agonist. We all know that is a negative thing. Inverse agonist. See, obviously I told you affinity will be high. So affinity low things, we can rule it out. Affinity will be high. Intrinsic activity is negative here. Intrinsic activity is negative. Intrinsic activity high is, this is negative. So this is the correct answer. In this way, you can answer these questions. So he can play football with these kind of questions. Literally, exam will play football with these kind of questions. Very basic questions, and he will ask you in whatever way he wants to ask. Okay, now I hope it is clear.